think about the journey that the person is on, the cared for person is on, whatever condition it is they're living with, what that's going to look like tomorrow, next month, next year.
You're listening to the Care Podcast, brought to you by Unique Senior Care. We're here to share honest and practical conversations about how to navigate your care journey. We're joined today by one of our co-founders and directors, Phil Maundrill. Phil has personal experience of arranging care for his mum who was living with dementia, so he understands some of the unique challenges that can be part of that journey. Today we're going to be thinking about the questions that families should ask earlier. What are the kind of things that they wish they'd known to ask about or understand from the start? So thank you for joining us today, Phil. We're going to be reflecting on what families maybe wish they had known earlier and known to ask at the start of the care. So in your experience with care for your mum, were there things later on in hindsight that you thought, I wish I had known that or asked that at the start?
There are actually quite a few things. I think the most important thing is to understand the consistency of staff, the consistency of timings of visits, because some people live by the clock, and I think always one of the questions should be early on, how are you going to be there at 8 o'clock in the morning, and are you going to be there at 8 o'clock in the morning, as you say you are, and how often are you going to send Sally, and how often are you going to send Susie? I think those things are really important. But then beyond that, think about some of the other things that are time consuming for you as a family member when you're thinking about your loved one, that the care provider that you use, whether it's us or anyone else, could also help with. And I think outings, taking someone to the garden centre for a slice of cake and a cup of tea can actually be really life enhancing. And this is all about quality of life and improving, the cared for person's quality of life. And anything that they like to do, which sometimes you have to do, or is a bit of a drain on your time, think about, is that something that I could ask the care provider to do? Because we as an organisation would be delighted to take people to a National Trust property or to their local supermarket to do their weekly shop. And that adds interest to a client's life. This isn't just about providing a service in the home, it's actually about taking some of the responsibilities away from family that can be burdensome.
And is there anything else that in your experience of dealing with families and talking to them about their care they have, anything that you think they maybe overlook or don't consider at the start?
Yes, I'd think about the ad hoc situations that come up in life. The hospital appointments or GP appointments, the dental appointments or the optician's appointments that we all realise can be quite a drain. Having to book a day's holiday to travel to your loved one's home to take them to the appointments that are in their daily life, but ad hoc appointments. Think about those, because that's something that most care providers would be able to support with, and that's clearly a big relief. To be able to take someone to an appointment, but be there first thing in the morning to help them get their shoes and coat on, take them to the appointment, accompany them during that appointment, and then take them home and do the reverse, make a cup of tea before you leave, is actually quite nice, and makes it a bit of an adventure for your loved one too. I think those kind of things. Think about the ad hoc ones, which could also be something that would make your life easier.
Yeah, and I guess it could be quite tricky if you're still working or you live further away, that it's not just easy to pop mum down to the doctor's appointment, which is almost always in the week when most people are working. So that takes that strain off, and that the person that's going to that appointment also knows your loved one really well, and can make sure that they give across the information to the health professional that perhaps the individual themselves might miss out or not know.
Yeah, I mean, the service is a real insight into people's condition in many instances, and that is something that, visiting the GP, you can talk about and add to. Clearly, walking into a doctor's surgery is different to walking in and sitting at the doctor's desk with a client. But if that is something that a client might be keen on a caregiver doing, then of course we can do that too. And I think those kind of pressures of spending a day to take someone to an appointment that might last 10 minutes really is quite a burden. Save your holiday, keep it for those times when you want to, be here for a length of time and not just servicing a need.
Yeah, then you can do something more special with your family member or your loved one instead.
Exactly.
Yeah.
And that's the other thing I would say too, is that remember this service is actually about helping clients live the life they want, but also relieving family members of the mundane tasks day to day, the washing, the ironing, the emptying the bins, the cleaning the bathroom, that kind of thing, which is all things which fall within our service.
Are there any ways in which families can maybe find out about what's happening day to day, that they can get access to the information of what's happened in the visit? What might be something that would be helpful to know about that?
Yeah, I mean, most organisations operate with digital care systems these days. We do. And access to care notes is something which for us is just around the corner, and that's remote access to notes of each visit. It's coming, but it's not quite here yet. But to be able to look at what happens at each visit on a mobile phone or an app is something that would give people the reassurance that mum's had her breakfast, she's taken her medication, and whilst they were there, they undertook certain activities between them, and sometimes it also highlights, patterns of changes in behaviour, which could also indicate, conditions that are developing that develop over a longer period of time. So, visibility of that, it's what we use, but being able to share it with family members is something which we think there's some value to. Understandably, it needs client sign off. We don't automatically give family members access to this kind of information because it's client choice. But with the right kind of permissions and the right kind of systems, of course, it's very feasible.
Great. And what about one piece of advice you would give if somebody is thinking about setting up care? The one question you would really recommend them to ask?
Yeah, my advice would be on the one question is think about the journey that the person is on, the cared for person is on, whatever condition it is they're living with, what that's going to look like tomorrow, next month, next year, and think about how the service that's being provided might need to change, and therefore, have it in your mind that things will change because naturally that's life's natural progression, and start to think about what that future might look like. I think that's quite an important thing to consider.
Thank you, Phil, for sharing what you think are some of the questions that people should ask earlier on in their journey. I think people will find it really useful. And thank you everyone for listening. We hope that this episode has provided you with some practical ideas and reassurance in your journey. I'm Jo Cleary. You've been listening to the Care Podcast, and we'll see you on the next episode.